Good evening, everyone. Today we'll discuss the fall off of twin pregnancy in monochorionic twin pregnancy versus dichorionic twin pregnancy. The dichorionic twin pregnancy, you can see in dichorionic is less complicated. The dichorionic twin pregnancy, you have to start the first scan in dichorionic or whatever it is monochorionic. If you compare the both monochorionic versus dichorionic twin pregnancy, from the first scan has to be done the same, that is 11 to 14 weeks. In this what are the things you have to see, that is the in the first scan in the monoclonal or dichron whatever is your dating has to be done, proper dating and leveling up twin has to be done, and you have to determine the chorionicity. The same here also in the monoclonal twin pregnancy, dating and leveling and chorionicity, and the screening for trisomy 21, that is your NT scans or dual marker testing you should do. NT scan and nasal bone has to be seen both babies. Okay, then now the difference starting from after this scan, the difference start between monochorionic versus dichorionic twin pregnancy. Now the differences will be there. The first difference is the monitoring start in the monochorionic twinning is pregnancy is the major difference is from 16 weeks the starting of the first ultrasound, the second ultrasound. In here what are the things you have to see, from 16 weeks you have to monitor in the monochorionic pregnancy. It is a fetal growth, you have to see fetal growth biometry, and ductus deep vertical pocket has to be seen, and umbilical artery PI has to be seen in the umbilical in the 16 because there will be chances of twin transverse syndrome. So in the monochorionic is more complicated, so you have to do the scan earlier, that is 16 weeks. Then again you have to follow every 2 weekly, very important. 2 weekly you have to increase, every 2 weekly you have to follow. The here the follow is every 2 weekly till the date of delivery, that is the usually the monochorionic tuning is terminated at 36 weeks. So basically 11 to 14 weeks start with the dating, labeling, chronicity and screening for trisomy 21. Then you start the next scan has to be given to from 16 weeks onward, every 2 weekly till 36 weeks you will do every 2 weekly, and from 16 weeks you start with fetal growth and ductus deepest vertical pocket, umbilical artery PI. Again 18 weeks fetal growth, deepest vertical pocket and umbilical artery PI. And from 20 weeks the two things is they added, that is your fetal biometry already has been done, and detail here that like your normal anomaly scan you have to do a detailed anatomy scan, and they have added here the point is MCA PSB has to be added, and the same DBP fetal growth already there, umbilical artery plus detailed anatomy plus MCA PSB, and very important because twin pregnancy is more prone to the preterm labor, so we have to do a cervical length. So basically if you discuss the things for the difference, easily remember the starting from 11 to 14 weeks dating, labeling, coronary screening for trisomy. Then from 16 weeks you start every 2 weekly till 36 weeks, 16 weeks every 2 weekly till 36 weeks, the second point. Then the in the 20 weeks you will add along with this fetal growth plus ductus venous deep vertical pocket plus umbilical artery PI, you have to add MCA PSB to rule out fetal anemia. Then you have to add the detailed anomaly scan, normal fetal anatomy scan. Then you have to add the cervical length measurement. These three things are added from 16 to 20 weeks. Again in the 22 weeks you will do the same things, the only the cervical length has not measured, the fetal growth has to be measured, deepest vertical pocket has to measure, umbilical artery PI, MCA PSV. Now the same thing is we continue fetal growth deepest every time. Now the difference you can see here from a DCDA twin, that is a dichorionic twin pregnancy, the same is from here the same things difference is from 20 to 20 weeks you will do a detailed anatomy, biometry, amniotic fluid volume and cervical. Here you no need to do a routine Doppler in dichorionic twin pregnancy unless there will be a fetal abnormality, because there here monochorionic you have to do routine Doppler has been started from umbilical artery PI and it started from 16 weeks, and MCA PSV, remember umbilical artery PI has to done from 16 weeks onwards, and MCA PSB has to done every 2 weekly from 20 weeks onward. Okay, very important in monochorionic, but here in dichorionic there will be no need to do the Doppler findings in 22 to 20 weeks. But then here the follow-up is like every 4 weekly till delivery, then 24 to 26 weeks another scan, 28 to 38 weeks another scan, then 30 to 34 weeks then the fetal Doppler has to be done. After between 24 to onwards you can advise for a fetal Doppler assessment, fetal growth and fetal amniotic fluid volume. So now the difference is first is the same thing is you have to do 11 to 14 weeks. The dating labeling chronicity is same as for dichorionic, but the major second ultrasound has been start from the monochorionic is 16 weeks onward, every 2 weekly, every 2 to 2 weekly till 36 weeks, but dichorionic every 4 weekly till delivery. Then umbilical artery PI has been the difference is in the monochorionic pregnancy, the from 16 weeks you will do fetal growth, deepest vertical pocket, and umbilical artery PI. In 20 weeks you add MCA-PSB, MCS-PSB, and cervical length measurement, and the anatomy scan, fetal anatomy and anomaly scan has to be done. Then 20 weeks, 24 weeks, 26 weeks, the fetal growth has the every 2 weekly you have to do a Doppler for these patients. Umbilical artery PI, MCA-PSB in every 2 weekly, every follow-up visit you have to do Doppler. But in twin DCDA, dichorionic twin, no need to do every, like you have to do every 4 weekly fetal Dopplers. Okay, only after, not in 20 weeks you will do fetal Doppler. Here the fetal Doppler is not done in 20 weeks, you have to do start from the 24 weeks onwards, then 24 weeks, 28 weeks, and 32 weeks, 36 weeks, then till delivery you assess fetal growth and amniotic fluid in the fetal Doppler. The umbilical artery PI should like not mention here to do here as per the ISUOG guideline. Okay, so these are the follow-up for monochorionic versus dichorionic twin pregnancy. So very simple. Start from 11 to 14 weeks, both dichorionic whatever, monochorionic, dichorionic. Then that dating, labeling, chronicity, screening for trisomy has to be done. Then from 16 weeks onward, monochorionic has to be done every 2 weekly. First fetal growth, umbilical artery PI, and your deeper vertical pocket. Then you add 20 weeks onward, you add MCPSB and cervical and just added in the 20 weeks. Then you measurement, if it is less than 2.5 or you serial measurement has to be done. Same thing in dichorionic also. In 22 weeks, the umbilical artery PI and MCPSB has to be continued. In the monochorionic pregnancy, every 2 weekly, and fetal growth. Okay, and amniotic fluid volume. Then same things, but in dichorionic, you start from the second scan, 20 weeks, like anatomy scan, cervical and amniotic fluid has to be done, till anatomy scan has to be done. Then 24 to 20 weeks, you do fetal Doppler will be added. The same thing every 4 weekly, monitor till this is 2 weekly, this is 4 weekly. Thank you. If you like this, please subscribe. Thank you all.